Good afternoon. This is session 332, Helping Teens Manage Stress. And just one more reminder in case you haven't heard today, it's the last day for Posters on the Move till 7 o'clock tonight. Breakfast in the morning is by ticket at 8 o'clock. And Zumba is at 6:30 in the morning. You can still register at the registration desk. Our speaker is Kimberly Ehrlich. She's a pediatric nurse practitioner in adolescent behavioral health at Sutter Health Systems in Northern California. She coordinates a regional effort to expand access to mental health services for adolescents through primary care. In addition to co-managing a specific caseload of complicated cases with pediatricians and behavioral health clinicians, she trains pediatricians to better screen for, identify, and refer adolescents with behavioral health disorders. She has a Master's of Science in Nursing from Yale University and a Master's of Public Health degree in Maternal and Child Health from Tulane University School of Public Health and Tropical Medicine. Please help me welcome Kimberly Ehrlich.
So sorry about the huge room. It makes it look like there's nobody here. I know it's the last session of the day, so I really appreciate everyone sticking with it for this super important topic on helping teens manage stress. So before we get into the thick of it a little bit, one thing about this talk that's going to be a little bit different from some other talks that you've had here, this talk is not going to be so much about what to recommend as it is going to be about what to do in clinic. Less about recommendations and more about how you can impact change during the clinic visits themselves. So hopefully that'll be kind of a new and interesting twist for you all. So I have no disclosures. You have my learning objectives there. Number one, to recognize the health effects of poor stress management in adolescents. Kind of self-explanatory, listing the components of a well-stocked stress management toolkit, which is what I'm really hoping that you'll take away from this talk today, and then listing 3 outcomes of improved stress management in adolescents, and those can be physical or behavioral. So I really like the Stress in America study. This is something that they do every year from the American Psychological Association, and they have a different focus, a slightly different focus each year. The one from 2014 was about adolescents and how they experience stress. So some of those statistics are pretty interesting, but overall, what the results of the study from 2014 showed are that adolescents are experiencing stress in equal and sometimes worse and more impactful ways than their adult counterparts, which is pretty interesting. So essentially it showed that teen stress rivals that of adults, with 40% saying that they're irritable or angry, 36% saying they're nervous or anxious, 31% are overwhelmed, which overwhelm is, the non-clinical term for stress. 36% being tired, that's obviously an underestimate there. 30% saying they're depressed or sad. That one's kind of interesting. So we know from related studies that although 30% of teens said that they were feeling depressed or sad or had a sad mood, they actually don't feel like, they don't report that depression or sadness has an impact on their physical health, which we know is not correct. So we know that that's really about their experience and their developmental lack of abstract thinking to realize what the impacts of those feelings are on them. So do you guys all know the dirty little secret about stress? So the dirty little secret of the stress system is that it responds to and is activated by psychological stresses of modern life, like your AP Chem test, in the same exact way that it responds to physical dangers like the charging saber-toothed tiger. That's really true, which is why you see these adolescents who are completely overwhelmed report that they feel stressed out, but it's at such a heightened level that it seems they live in crisis mode all the time. And that's one of our collective jobs, right, is to determine the difference between those people who live up here at crisis mode 100% of the time, or the people who really kind of live down here and they're having a blip, and how to deal with that. And that distinguishing one of those from the other, I think is really important in thinking about how you're going to be able to help them manage stress, which tools you're going to choose to help them manage stress. A little plug here about this quote. This quote I adapted from Wendy Suzuki, who wrote this amazing book that was just published. She's a neuroscientist, And the book is Healthy Brain, Happy Life, and it's all about how exercise impacts the brain, and it's all based on her personal research, which is really, really highly recommend that book if you're interested in a book about how exercise affects the brain. So let's talk for a minute about the difference between stress and distress. So stress is the body's response to some stimulus, and the response itself is what interferes with function. So the response itself causes a functional impairment. So let's take a sort of a classic example of that. Someone with anxiety that maybe has somatic symptoms, maybe they have sort of classic panic attacks, their heart rate goes up, they feel like they can't breathe at all, they are hyperventilating, that causes a functional impairment, right? Some people don't have it at that level. They still can experience stress. We've all been in a situation where we have deadlines approaching, and we don't necessarily have those symptoms. But when we start to have distress is when we really have those symptoms that are impacting our function. So if you think about it, that actually mirrors the definition of a behavioral disorder or any disorder. The mark of when a symptom becomes a disorder is when it causes distress. So I kind of like that feature there. So what are some factors that are associated with psychological stress? I'm sure you can think of these, but I really like the way they're characterized here, particularly pertinent to teenagers who feel like they have no control over situations. They don't like the fact that they don't have any predictive information about what might happen, what might be on that test next week. The teacher hasn't given us any information about what might be on the test. They don't know what could happen. They feel like they don't have any time for leisure outlets, like hanging out with friends and that kind of thing. They feel like a situation is only going to get worse, and we know that sort of hopelessness is one of the things when we think about depression. That's one of the sort of hallmarks of being concerned for someone who feels hopeless. And that's the same thing with stress here. They don't have any hope that it's going to get any better, especially if they're maybe a freshman in high school and they see all these upperclassmen that are just continually stressed out, and they have no hope that it's going to get any better at all, which is really disappointing. So we'll talk for a minute about the physiological origins of stress. I don't need to read the slide word for word because most of you know about the physiological origins of stress, but there we have our friendly, or not so friendly, saber-toothed tiger again. So we remember that the stress response is one of sympathetic nervous system activation, and we have a release of hormones that are stress mediators. And when you have this on your own tablets or computers, you can take a look at the fight or flight in the graphic that's on the lower right. It really talks about all the systems that are impacted by that. So one interesting thing about teenagers and stress is that they really do have a completely different reaction to stress than adults do. How is that so? Well, there's a hormone called THP, which is tetrahydroprogesterone, also called allopregnanolone, and it's a steroid hormone, and it's something that actually positively mediates the stress response in way younger kids and in adults. So it's protective, sort of neuroprotective, but it doesn't work that way in adolescents. They respond to secretion of this hormone in sort of a different sort of backward way, which causes them to have the stress response they do. Also, we know developmentally from fMRI studies that teens have much less activity in their frontal lobes than adults do, making emotional regulation extremely difficult. So when they feel like they're out of control, they really are. They have sort of a reason, if you will, to be out of control and to feel like they don't have a handle on their emotions. In a similar way to the fact that we wouldn't necessarily expect a 3-year-old to have good emotional regulation, right? But teens don't have that for this different reason. So we'll talk for a minute about chronic stress. Although the bulk of this talk is not about chronic stress, we've had in the not-so-distant past at this conference several talks about the impact of chronic stress, and I think that's more and more prevalent. But if you go back to the slide where I talked about the fact that our stress response system reacts the same way, whether it's chronic stress or the AP Chem test or the charging tiger, that's where you get into a problem of people who experience chronic stress, and your stress response system lives at that high level all the time, and that's what causes that symptom of hypervigilance that people with anxiety often have. And it increasingly sensitizes the body to stress through amygdala and hippocampal damage, again seen on fMRI. So the easiest way to screen for these psychosocial risk factors for chronic stress as well as acute stress in primary care are to use an ACE screener. They're fairly long, and that's the Adverse Childhood Event Screener. I tend not to use that in everyday practice because I think I do a pretty good job just in my general history of a new patient asking questions about their life, so you can get a lot out of that. But some people who are super research-based or want to do research into the ACE screeners, you could certainly use that. And obviously, you know, the HEADS assessment is great for stressors as well. You can get a lot out of that. So what about the health effects of stress? So these seem kind of obvious, right? Definitely, we know that stress can affect sleep. Many of us attended the sleep talk yesterday, which was great. Was it yesterday? Yeah. And I need more sleep, obviously. Anyway, it was great, and it talked about you know, the impact of sleep on many body systems. So stress is no different. People are more sensitized to stress when they have not had enough sleep. Stress also impacts functional memory and learning through those brain structures that I mentioned a couple of slides ago. Also impacts mood, like I talked about at the beginning. Also can impact immune system functioning, which is very interesting, but we have a substantial amount of evidence at this point that immune system function is stronger when you have less stress, especially chronic stress. We know that that stress can impact reproductive function. We know that people who are under chronic stress as adults, and we can definitely extrapolate, I think, to adolescents, but adults who are under chronic stress have more reproductive problems, lower sperm production, and therefore sperm counts, and things like that. Musculoskeletal problems can result from too much stress. Many people who report that they have stress or overwhelm in their lives have sort of chronic musculoskeletal tension that they feel. They're also more susceptible to the effects of any musculoskeletal sort of chronic pain syndrome that they have. Cardiovascular effects are what a lot of people think about, which is why when we are super stressed out and we keep on our schedule of going, you know, to get to the gym or whatever our favorite exercise is, we generally feel better because it's mediating those effects of stress. And then GI effects of stress, lots of people are familiar with that, where you can have, you know, increased symptoms of acid reflux when you're increasingly stressed, even if you're not eating spicy foods or caffeine or those sorts of things, because we know that there are more nerve cells in the GI tract than in other places as well. So why is it important to manage stress? Well, you're probably looking at this thinking, this answer is so obvious, right? Well, it is on the surface, but in order to truly build a toolbox that helps teens manage stress, we need to really drill down deeper. So we know that adequate management or improved management of stress can really promote positive self-esteem. When kids feel completely overwhelmed, they don't have good self-esteem. It's a fact. When they manage stress in a better way, they have healthier social skills, and we'll talk about that in a little bit when we get into the toolbox. Managing stress obviously prevents anxiety. That's my favorite sort of obvious pearl there. Prevents sleep deprivation. You see with sleep that really it's sort of a two-way feedback loop there, where sleep begets better management of stress, and better management of stress also begets sleep. It's also essential to the well-being of the family unit. We learned in one of the talks earlier today that was on military families. She talked a lot about the stress of that, and I think that's a good example of how managing stressors around specific family social situations are really helpful for sort of the well-being of the family function as a unit. And managing stress now in adolescence really does promote resilience later in life, which is definitely what we would want for all of our adolescent patients. So what do I think are the essential components of a well-stocked stress management toolkit? Well, I'm sure we could all sort of come up with, you know, a handful of things that we would like to see there. These are mine. I have them in this order, but obviously I don't know that they really need to be in any order. Time management is one of my favorite ones. I spend a considerable amount of time in clinic with patients talking about time management. This is definitely something you can do in clinic, and I'll show you a tool that I use for that, which I made, and it's available in your packet at the end of the slides as well. There's a blank one for you to help with time management. Routine development. That sounds, again, really obvious, but this is something that people struggle with a lot. Adolescents struggle with development of routine. They don't realize how helpful it is to have a routine, and it's helpful if you point it out to them when you're talking through what their stressors are in their life, you can kind of obviate for them that part of their stressors are that they're doing a different thing every day. They don't have a set time that they're doing this or that. And it's helpful that you can actually sit and through this counseling, talk through a normal routine for them, because obviously they've gotten sort of off the wagon, the wheels have come off, and they don't know what a normal routine is anymore. Then I really like the tool of behavioral activation, which most people think of as a tool for depression, for managing depression, but I use behavioral activation all the time in my practice for depression, for anxiety, for social stuff, for stress. Very, very helpful, and we'll talk about that. Communication skills, again, maybe not one of the things that you all sitting there would think is part of a stress management toolkit. Well, I'll show you how communication skills can really, really promote adequate or better stress management. Mindfulness-Based Stress Reduction, those who know me know that I'm really into mindfulness and really believe that's a helpful tool. I did say at the beginning that I was going to focus on things you can do in clinic and not things to suggest for patients to do, but I'll show you how you can really talk about this and show them how mindfulness can be helpful while you're in the clinic visit. And then last but not least, advocacy. We've heard a lot about advocacy so far in this conference, and that definitely goes for helping them manage their stress as well. So here is my tool for time management. And again, there's a blank one that's in your packet for you. This is a simple sort of time wheel. And why do I like this? Well, let me go to the next slide and I'll show you. So there's the example of how I would use it. Hopefully the colors come through and you guys can all see. So I'm sure you have a bunch of adolescent patients where you ask them about their schedule and you tell them that you notice that they're getting inadequate sleep, and you tell them this and they say, well, I can't possibly go to bed any earlier because I'm up doing homework, and before that I have swimming and polo and violin and I have to take care of my little sister, right? And then there's no time in the day for any other thing. So I really like to use this tool to show them how what they're telling you translates into something actual that they can kind of take home and see and realize and talk about with their parents that they need to make a change. This tool is almost more useful for parents than it is for the teens themselves. A lot of times in my practice, it's the parents who feel like the teens have to keep up with all of their extracurricular commitments, otherwise X, Y, and Z will happen, and we can all postulate like they won't get into the best high school, they won't get into the proper college, they won't have a good life, whatever that means, right? But you can't have any of those things if you've completely fallen apart, right? So I really like this tool. So in this particular example here, you see that this is on purpose, I've made this sample to mirror sort of a classic adolescent schedule. So this adolescent is sleeping from midnight to 6 a.m. They have two hours in their day that are unaccounted for, right? In this example, 2 hours in 24 hours that are unaccounted for by some activity, including school. And if you look at it, those are times during which they should be getting up, getting ready for school, having some sort of breakfast, and maybe attending to personal hygiene, which I'm sure we would all agree those things should be a part of those 2 hours. But then they're at school from roughly, 8:30-ish until 3. Then they have soccer. Then they go immediately to violin. Look at how small the little block for dinner is. That's the light blue where I've written it onto the side. That's like a teeny tiny half hour after 2 activities. And then they sit down to do their homework all evening, and they have virtually no time for those leisure outlets that we talked about. So this is a very useful tool. There's a little meme that I found online that I really like. Unfortunately, I don't have a picture of it, but I've been using this, just sort of talking through it with patients and families a lot in clinic lately, and it says, your kid's mental health is more important than their grades. And I really like that. I wish I had found it before I submitted the slides, but it's true. I think we're skipping one, maybe not. Okay, so let's talk a little bit about routines. So this is it's an adaptation from a book called Daily Rituals, and it's very interesting. This is not meant for you to be looking at it effectively here, but it's very interesting. Basically, all of these little circles on the left under creative routines are significant people throughout history, and it talks about how how they organize their day, and these are people that by all accounts we would all agree are successful, like Beethoven, right? Maya Angelou, those are some of the examples there. And it talks about, how much time they allocate to sleep and hygiene and eating and exercise. It's very interesting. So this is definitely something that I would have you look at in terms of figuring out how to help adolescents kind of make their schedule based on that wheel. So here is the tool of behavioral activation. I'll show you how I use that again, something that most people think of as more useful for depression, definitely useful for stress, which we all know leads to depression. So behavioral activation, just to remind those of you who don't use this frequently in your practice, is about learning how to walk the walk. You bring it until you feel it. So how does that work? Well, it's a cognitive behavioral therapy technique to really just increase the frequency of positive experiences in one's life so that your brain will get used to that sort of reward and then will be better about activating to do it on its own. It helps to break the cycle of stress, and it really, really helps with motivation. So what you have on the right side of the screen there is a little example. I've simplified it quite a bit for this purpose, where you have them, and you can do this again in clinic. I don't recommend sending it home with them and having them do it because they won't do it. Like as a worksheet, they won't do it. But I do it in clinic all the time, and it definitely counts, toward your visit as that counseling. And so you're making a specific plan for behavioral activation when they say they don't have any time for leisure because their schedule is completely filled. So they then tend to lose interest in those things, right? But you want them to maintain their interest. So you talk about making very, very basic plans. And the idea is that you have them keep one basic plan to start with per week, even if they don't feel like doing it because they're exhausted or stressed or whatever that means for them, and you have them commit to doing those things for fun and personal enjoyment once a week, even if they don't feel like it. And after several weeks, they've retrained their brain to enjoy those activities, and they actually do feel better, which translates directly to them telling you that they feel better equipped to manage the stressors that are typical in their lives. So then, problem solving as another technique, another piece of your toolkit. So we have here the problem. We all know about different methods for problem solving. I really like this stepwise approach to problem solving for adolescents. Again, this seems painfully obvious, but it's not for them because they're coming to you with a problem feeling completely overwhelmed from stress. So you do need to kind of sit down with them and go through this. So they'll tell you, for example, you ask them, what are your top 3 stressors in your life? And they'll tell you social stressors, this, that, maybe they're being bullied. This is really good to use for making a specific plan for how to help them handle things. And you're really being a good role model when you do this. You're modeling planful problem solving, stepwise approach to problem solving, and that's not something that they've seen usually done in such an obvious way before. So it can be really helpful, where you help them to define the problem, and often the problem that you're helping them to define is not actually what they've told you the problem is. Then you help them brainstorm possible solutions to their problem. Then you help them choose the best solution. Usually it ends up being something pretty obvious out of the possible solutions. And then you help them make a specific plan to implement their chosen solutions. A little plug for the EHR systems here. I often send myself reminders to email. Most of my patients are, we have a system through Epic, My Health Online, where they can email me and I can email them. And so I'll set myself a reminder if it's a kid who worked really hard on this and they tell me that they're going to make a specific plan for exercise or something very specific. I'll set myself a reminder. It takes maybe 5 seconds to do that in the electronic health record system, and then it'll automatically then, I can pre-program it to email them and ask if they carried out their specific plan, and even just doing that is very motivational for them, and that can all be done while you're sitting there in a visit, and then it automatically sends it. I don't know if you all have that capability, but a lot of the systems do have those types of capabilities, so I would check into that because it's very quick. And then when they come back the next time, you talk about how they might have implemented the solution, and you kind of review, and it comes really full circle then. And then they can see how this, again, planful problem solving that's really stepwise in nature can help them to manage and overcome stressors in their lives. So another piece of the toolkit is communication skills. Remember when I talked about how that's sort of an unnatural or unusual component of a well-stocked stress management toolkit? Well, I think that communication skills are part and parcel of managing stress in an appropriate way via social competence. Now this is a little bit different than the other components, so it might take a little bit to get there in your minds. But if you think about social competence as the ability to achieve one's personal goals through social interaction while maintaining positive relationships with everyone around them over time, and it's also a protective factor, everyone would argue that. How can you help teens in your practice really develop that? Well, part of that's just maturity, right? That's going to come with time. But helping them to develop it maybe earlier than they would have naturally, developmentally over time, can help them to manage stress now by having a positive relationship with a non-parent adult. Lots of kids have that in their life, but lots of kids don't. And even just having these conversations with you in the clinic represents this positive relationship with a non-parent adult. You can show through the steps that we just talked about in the prior 2 slides, behavioral activation and planful problem solving, how you can be a mentor for them. And then finally, you can develop social competence with teens and their families by really being an ally with their parents, supporting effective parenting, recommending parent coaching when necessary. We know how hard it is to support effective parenting. I wish it were as easy as just throwing those words up there on the screen. A lot of what I do in my practice is sort of parenting education, parenting training. You know, people come in with all sorts of behavioral complaints, and a significant proportion of the time it boils down to how parents are managing it. And it's just kind of a sticky one, because you don't want to come across as, a know-it-all or anything like that, because then they just distrust you immediately. But, I'm just very sort of casual about it, and I say, everybody needs a little help now and then. I tell them I'm a parent too, and I maybe give a couple of personal situations from my own life with my child, and I really talk about it as being a supportive thing. They're coming to you with a problem. They're asking for help by the way that the child presents and by their heightened level of concern for how the child presents. So if they're asking for that help, you can help them by supporting their effective parenting, asking them to try a different way next time, laying out what that different way would be. For example, with younger kids, we all know about, teaching active ignore, right? Well, that's great for adolescents as well. You should tell parents to they have to pick their battles, right? Do they really care that the kid has green hair, or do they care that they've picked 5 AP classes for next semester? So you can really support them there. And I often do refer for parent coaching, which is something you can refer for, just like you would refer out for individual or family therapy. You can refer for parent coaching, and I do that all the time. So I would really encourage you to get familiar with folks in your community who take a variety of different paneled insurances for patients that you see most commonly, people in your community who are therapists or clinical psychologists even, who are parent coaches and are effective parent coaches. And then you can kind of have that in your arsenal to recommend and make direct referrals where possible. So my little plug for mindfulness. Again, how can you do this in clinic? So obviously this is something you're going to suggest, but I recommend that you become familiar, especially if you're someone who's interested in mindfulness like I am, you become familiar with some of my favorite apps, which you can load onto your phone. Many of them are free. There are paid versions as well. My favorites are Calm and Headspace. Both of those have now gone to a subscription-based purchasing plan, which I think is fine. And then that way you can actually whip out your phone during the clinic visit, and you can show them what the content is like, because most of the people have no idea what that's going to be. Like a guided meditation, most people who've not done it have absolutely no idea what that's going to be like, and they're kind of feeling like it's very new agey and really woo-woo. But if you show them kind of how it works, in the same way that you might show them how to do abdominal breathing in the clinic. Again, you can spend 2 or 3 or 4 or 5 minutes doing this as part of a very comprehensive behavioral health evaluation with recommendations for things that they can do on their own. So we know that meditation can change the way the brain thinks, right? We have fMRI studies that show this. It increases the brain's ability to cope with stress, promoting emotional regulation, which is sort of the whole point of managing their stress in a better way. And we know that emotions are the barometer, really, of well-being. A note on my favorites for guided meditation. Again, it's a really great way. Guided meditation in general is a great way to get into Mindfulness-Based Stress Reduction for adults, for kids, for adolescents, for everyone, I think. And there are free versions of both Calm and Headspace and a bunch of other ones, but my absolute favorite is Calm. Calm.com, or it's in the App Store, and it's now $39.99 for a year subscription. And you're thinking, what? I thought you said it was an app. Most apps are like 99 cents, right? Well, they have a free version, but the free version doesn't have the expanded content. And the way that I talk about this with patients and families who are interested is that most of your patients would have no problem paying that $39.99, $40, let's say, for a prescription, 90-day prescription, right? But this is $40 for a year of content. Can be really, really helpful. And it's helpful to actually show them, and it doesn't take very long at all to do that. So the last part of the well-stocked toolkit is advocacy. And again, not something that most people would traditionally think would be part of the well-stocked toolkit, but I really think it is. Again, the person who did the sleep talk yesterday talked about the first bullet on my list here, delayed school start times. And I really want to put in a plug for that as well. So this is something you can do to help teens manage stress better, is you can be a good advocate for things that support their behavioral health, not just their physical health. You're great advocates for things that support their physical health, right? You ask all the time in anticipatory guidance if they, wear helmets and knee pads and all that sort of stuff, right? So this is exactly the same, except you're protecting their behavioral health instead of their physical health. So delayed school start times is definitely one of those things that you can help with. So how can you help with that? Well, not just by having a conversation with the kid and the parent, because they feel very powerless to do anything about that. But the AAP and the American Academy of Sleep Medicine have both come out with position statements on delayed school start times in support of delayed school start times. And the American Academy of Sleep Medicine in particular has on their website, I'm sorry, I don't have the link there to it, but you can just search on their website and find it fairly easily. They do have a link on their website for a form letter that you can submit to school districts in your area that show that you're in support of delayed school start times, and it has all of the evidence right there, so you don't have to go around and collect it. You can just kind of put it out there just like that. Another piece of advocacy is block schedules. A lot of schools, high schools especially, have gone to block schedules already, and that can really help with managing their stress as well, so that they don't have every class every day. And then homework policies. So it's been proven, you all know this by now, that homework does not lead to increased competence in academic subjects. It just leads to more homework. So advocating for homework policies that don't load unnecessary hours and hours of homework onto adolescents can be very helpful as well. You can even just write, I actually have a form letter that I use that has all of these in there that talks to school personnel about how they can help manage the overwhelming stressors in their student body. And then we have the little cartoon there on the bottom that's kind of the classic teenager, right? How do they expect me to sit here at 1 a.m. doing homework and still stay awake in class? And then the teacher says, hey, no sleeping, right? And so we know from Judith Owen's talk on sleep that it's hard for them to get to bed before 11 because they're just not tired, because their natural release of melatonin is much later than ours, which we know. But if they don't go to bed until, let's say 1 or 2 or 3, and they're getting up at 6:30 or 7, that's simply not enough sleep to function well. And we know that that can leave them susceptible to these effects of poor management of stress. So if we look back at the toolkit that we've built so far, we have our nice little toolkit here, which has time management, my favorite, communication skills, development of routines, being a great advocate, helping them with problem solving, showing them how they can manage their stress through mindfulness-based stress reduction, and then using behavioral activation. I think these are really kind of a nice grouping of things that you can implement. Of course, I don't recommend that you go back to your offices on Monday and implement them all at once. I recommend picking a couple that you're particularly interested in and or comfortable with and starting with those. Again, probably the easiest one to actually implement is to use that blank copy of the time management circle that I have and start doing that with them. I think that's really, really helpful. So, is stress management appropriate in primary care? Is it reasonable? It sounds like I'm talking about a lot of stuff that I'm doing in behavioral health visits, but you're not quite sure if this is something you can really make happen in primary care because you have such short visits. Well, I do integrated behavioral health, so I am functioning in primary care. Granted, I'm sure I have much more of a time in my schedule than a lot of people who are doing more of traditional primary care. But there's nothing that says you can't bring them back. This is something you want to address. Just like you have them come back, you know, they come in with a rash, you give them a steroid, you know, if it's still there, they come back, right? Or they come back for teaching. If someone's, let's say, a newly diagnosed diabetic, you do, you know, diabetes teaching, right? There's teaching for a variety of things. You do teaching for eczema, let's say, all the time, right? You talk about home management of allergies and asthma and those sorts of things all the time. So to me, this management around stress impacting their behavioral health is just like those pieces of anticipatory guidance that you use for all of those other things that are primary care focused anyway. You just need to kind of be comfortable with doing it in the primary care setting. It's definitely reasonable. So if you think about the conditions that have the highest prevalence and rapidly increasing incidence are conditions that are related to social, behavioral, and neurodevelopmental conditions. So it really does behoove you to address these things in primary care because these are the things you're seeing people for anyway. Especially for younger kids. We see lots of younger kids with behavioral health challenges, or behavioral challenges that parents come in and they say, you know, his behavior is unmanageable. Does he have ADHD? Does he have this? Is he not sleeping? You know, all of these things are related to social, behavioral, and neurodevelopmental conditions. Also, as we've seen in the rest of this talk, physical health status is linked to behavioral health issues as well. So that's something that's important for you to support, just like you would support all of their other physical health issues. Assessment and preliminary management of stress in primary care, like I said, really, to me, equals anticipatory guidance for teens. We're very familiar, especially as we leave, you know, our NP programs about anticipatory guidance in various age groups. There's Bright Futures. There's a bunch of different tools to help us learn what things we need to talk about at different age groups. But I think that this kind of gets left out. You know, there's maybe a bullet somewhere that talks about stress, but it doesn't tell you how to do that, right? So that's what I intended for you to take away from this talk, is really how to get into the weeds about it. Because this is the meat of anticipatory guidance for teens. When you're talking about developing that independence, starting to separate from their parents, allowing parents to give them more independence. They can't do that if they have no control over their emotions and they still have poor emotional regulation because they don't know how to manage their time and don't communicate with peers appropriately and aren't getting enough sleep, right? They can't do any of those other things that support their general health. Also, why you should do this in primary care is all about health promotion, disease prevention, early intervention, right? Well, talking about how to appropriately manage stress fits well with those primary care priorities. In fact, it fits exactly with one of those primary care priorities. Also, it's billable. Well, how is it billable? You just add it on, preventive medicine, individual counseling, and there's the codes there. I was just in another talk for ADHD before this one, and she talked about billing at the end, which I thought was great. But I had whispered to the person next to me that, unfortunately, I don't get a lot of feedback about my billing. I don't get any feedback, actually, about my billing. I don't know if you all have that, but that's something I wish I had more in my practice, so I would know, you know, if these codes are really making a difference and if I could see actually monetarily what they do. But even without me having that feedback, I do think it's important to learn to code appropriately and learn to sort of submit your billing appropriately, whether or not that gets reimbursed. It's even better if it does, but even if it doesn't, I think it's really important, particularly for nurse practitioners, as, you know, obviously we're always trying to show other people that our practice is worth something. And doing appropriate billing, where you really account for everything you're doing, is one of the ways that you can show that your practice is worth something. You can also bill for counseling for risk factor reduction and behavior change interventions. You can only use that code if there's no symptoms or established illness. So that's something you definitely would do, like in a well care visit, right? As long as if they tell you they're stressed, you know, you can. They tell you they're stressed, but they don't meet criteria for a diagnosis of anxiety or depression or anything else like that, then you can use this for risk factor reduction, which is exactly what it is, right? You're counseling about sleep, you're counseling about all of these things that are gonna reduce their risk factors for poor management of stress, leading to poor health outcomes. So I have a bunch of my references there. The time has gone fairly quickly here. I was hoping to try to get you out a little bit earlier than planned because I know it's the end of the day. And I talk fairly quickly as well, but I have all the references in there. And then again, you're also free to use that time management thing and free to make it your own and just copy it and have a stack of them there in your clinics. Any questions? You'll have to talk loud. So the question was whether or not I recommend vitamins, minerals like magnesium and fish oil and those sort of things for anxious kids. I definitely do recommend those things, not necessarily for anxious kids, but I'll tell you what I recommend. So omega fatty acids are definitely on my list of things that I recommend specifically for kids with depression. Most people, even people without depression, most teenagers have, the standard American diet, and they don't get enough of those healthy things anyway, so that's a good recommendation. But if you're recommending it specifically for someone with depression, I like to recommend a very high dose. That's a specific dose. It doesn't come from just eating fish like once every 2 weeks or something, right? So that's what I would recommend for that. She brought up the question of magnesium for anxiety. Definitely, I recommend magnesium. I usually recommend it in the form of this product called Calm, which is different, Natural Calm, which is different from the Calm.com app that I was talking about. And it's like a little powder, and they have different flavors. I think the classic one is like raspberry lemon, and you mix it into water or whatever you want. They also have an unflavored one if people prefer to put it in their drinks. And it's a standard magnesium, and I definitely recommend that. I think that's helpful. In addition, I recommend theanine. I think that's very helpful for anxiety as well. Although you have to be a little bit careful because a lot of our teens are also consuming a ton of caffeine. And when you mix theanine and caffeine, a whole different reaction happens. So you want to make sure that you're not actually mixing those. And like, for example, if they're having coffee or a Red Bull or something, when they sit down to do their homework at 9 or 10 at night, and then you're telling them they should take theanine right before they go to bed, that's a bad mixture. It'll just keep them up because the theanine actually potentiates the effects of the caffeine. So you really have to probe and ask. Does that help you with your question? Yeah, okay. Other questions? Usually like 3, she wants to know the dose for omega-3s. Everybody has a different perspective on this. There's several different published dosages. I use 3,000. That's what I like. Daily. Yep. Of course, this is not really a talk about that, but you need to make sure that they don't have any things that, in their medical history that would preclude use of that, like a bleeding disorder, because it can increase bleeding, that they're not taking, a load of ibuprofen for some other musculoskeletal condition, because that can increase the risk of bleeding and that sort of thing. So Katie here has the same problem we all have. She says that she notices that a lot of her teens that come in who are overwhelmed by stress are from families where the parents are also overwhelmed by stress and sort of just live at that high level of stress, and they link stress to success and busyness and all of that. And she's wondering if I have any pearls about how to get at that with the parents who might not really value the mental health piece of stress management, and she wants to know if I have any pearls for addressing that with the parents without getting them angry at me. I actually just don't care if they get angry at me. I kind of present it in a very obvious way. That would be my pearl, is to maybe not be so concerned about the fact that they might not like you or something. Because I used to be, more concerned about that, but now I just really present the evidence, which is why I like that round time management tool, because they're telling you how important all these other 17 extracurriculars are for their kid. But if they see it there like that, literally in black and white, that the kid has literally no time for sleep or leisure activities, and you just present them the evidence. And you can talk about this APA Stress in America study and what they found and how teens react to stress hormones in a different way from adults. And you know what I find actually mostly is that the parents who are like this, they get something out of hearing it as well. It takes a really long time to impact behavior change, as you all know, from your early nursing with Prochaska and DiClemente stages of change, right? It takes a long, long time, but you just kind of go over this every time and incorporate this into your practice. And it's kind of like when you have a recommendation for something else that they then, that's something physical, that they then don't follow, but then they keep coming back and wondering, why did it not get better? Why does my kid still have this rash and these asthma and allergies? Well, because you keep using your perfumed soap that you really like, and you have carpet in your house, and you don't do any sort of prevention there, but they keep coming back in, and the kid is wheezing and rashy and all of that, and you keep just presenting the evidence. We know that, children who are exposed to these things, who have a predisposition for allergies and eczema, tend to have a worse time with that. We know that it can impact their learning and their sleep and all of that. And I present this in much the same way. And it's, I don't mean to stand up here and make it sound any easier than it is, because it's not. I fight this battle every day in my practice. But my pearl would be to present it in a very methodical way. And I really like having something to show them, because otherwise it's just a conversation, which they've heard a million times. They hear it on the radio, they see it come across their email, their friends talk about it, but they think that it's all going to be totally fine because that's how they are. And it is really hard to fight. But the other thing that I like to focus on is, while it might have worked for them, the parents, maybe they are successful by whatever they judge that by, I remind them that they've come to me because the kid has a problem. They're there because they have a problem. And I actually use that kind of wording a lot with patients and families. I say, let's say when you're trying to get someone not to have caffeine, maybe it's a chronic headache kid, and it's like, well, their friend has no problem with caffeine and drinks coffee in the morning, a coffee in the afternoon, and a Red Bull throughout the day, and it's, well, my friend drinks that and she's fine. Well, your friend's not sitting here in my office totally non-functional and missing school because they have somatic anxiety, because they're overwhelmed with stress that has turned to distress, and now they have a disorder. So I just present the facts, like, you're here because you have a problem, and everybody needs a little bit of help with different problems, and here's how I can help you with that problem. And I'm happy to support you throughout the time that we're working together, but I need you to meet me halfway. And I think that meeting halfway is something that is really good. Hardly anyone is going to respond to a list of sort of demands, right? What if you went to your provider and they were like, well, you're overweight and you smoke and you drink and you this and you that and you don't get any exercise and you're stressed out in your job, and let's say they gave it to you on a sheet to take home, and your after visit summary, you'd get home and be like, well, this is hopeless. I can't do anything. So I like to pick one thing to focus on. Other questions? Yell out if you have a question. Nope. Okay. Enjoy your evening. Thank you.